Hey everybody, how's it going? So today we are back at Encore Physical Therapy to talk with Taryn about a really important topic, low back pain. You know, last week we covered the topic of chronic, but another thing that a lot of people suffer from is that back issue. And you know, Thoemaas Lozier here is one of my coaches, a phenomenal man, phenomenally educated in nutrition and in exercise, but he too suffers from chronic back pain. So we're gonna have Taryn show him some exercises and show him some flexibility work that's gonna help him get through that. All right, we'll see you guys inside.
How's it going, everyone? Coach Thoemaas here at Encore Physical Therapy, once again with Taryn.
So what I'm going to do, like Mike mentioned, is we'll give Thoemaas some exercises and stretches, but before I can do that, I need to have a really good understanding of what's going on with his particular condition. So typically, physical therapists and good physical therapists, along with good trainers, are going to give you an individualized program based off of your particular set of dysfunction. So we'll get right to it, okay?
Absolutely.
So I'll have you take a seat first on the side of the table. And we're just gonna clear a few things first, okay? So any numbness or tingling in either leg recently? No?
No.
Okay. So I'll just do a quick little neuro screen. So does that feel the same side to side?
Yes.
And here feels the same?
Yes.
And here feels the same?
Yes.
And here?
Yes.
And here?
Yes.
Here? And here?
Yes.
Yeah? Here and here.
Yes.
All feels the same? Okay. So what I'll have you do next is lift that leg up for me. Hold there, don't let me push you down. Good, and then lift that one. Hold there, don't let me push you down. Is this the side the issues have been on? The left side?
It does, yes, typically.
Yeah, okay. Kick that knee straight for me. Hold there, don't let me push you down. Good. Kick that one. Hold there, don't let me push you down. Good, now bend it. Don't let me pull you forward. Good, same thing here. Don't let me pull you forward. Good, and then toes and ankles come up. Hold there, don't let me push you down. Same thing. And then out like you're a duck. Hold there, don't let me pull you in. Same thing. And then big toes inside your shoes, give me thumbs up. Hold there. Good. Okay, now I'm gonna have you stand up for me. Now I'll just have you bend forward as if you're gonna touch your toes.
Oh, goodness.
Okay. Where do you feel that? Quit your bouncing. You feel it through there? Okay.
Yes.
And then come back up for me. I'm gonna have you turn your whole body, move your feet too. There we are. And I'm gonna have you take a step back towards me and bend forward again. Yeah, we got you that time, didn't we? Okay, and then come straight up for me. So just checking for scoliosis. You have a little mild one through your lumbar spine here. Any tenderness, I'm gonna roll this up. Any tenderness here?
No.
Okay. And I'm gonna poke you right in the bottom. Any tenderness here?
No.
Any tenderness here?
Yes.
Mm-hmm. Any tenderness along here?
No.
Any tenderness along here?
No.
Any tenderness along here?
Yes.
Okay. And I'm gonna have you, we're gonna do a repeated test right now. So this is for a lumbar disc pathology. It's like a disc herniation or a bulge. So what I'll have you do is bend forward like you're gonna touch your toes. And I want you to do that 10 times. And what we're looking for is if it changes any pain location or pain severity, okay?
Great.
No change in symptoms?
I felt some tinge of pain right here.
Was it consistent?
Relatively.
Like it happened, yeah.
And I was trying to stretch a little bit further each time. Yeah, I heard a little bit more.
Yep, okay. And then what I'll have you do next is hand on your hips there, and I want you to lean back for me as far as you can. Good. And then come back up. And I'm gonna pull this up just so I can see what's happening back here. And then go ahead and lean back again. Good, and back up. And let's do that 8 more times. And I want you to let me know if you have any change in pain location or severity. And with this, what I'm seeing is you actually have a tendency, we have almost like a hinge point here. So the skin is folding. So he's getting a lot of his motion at this particular level and not much up through the top there. You don't get any extra points for added range of motion here, especially because you got the hinge point, so stop.
That was it.
That was it? So did that give you any of those symptoms out here?
No.
Okay, yeah. All right, so what I'm gonna have you do next is I want you to just side bend to the right and then side bend to the left, but I wanna see what's going on in your back here, okay? So go ahead and side bend to the right. Good, and come back up and then to the left. Did one side feel more stiff than the other?
Right side.
Moving to the right?
Yep.
Yeah, interesting.
I felt
You
stiffness
feeling
right
it through there? Okay. All right. So what I'm going to have you do next, go ahead and lay down. You do present like you do have a little bit of a disc pathology, which we know given your history is the case. So yay, that lines up. So what I want to do next though is check out how your lumbopelvic movement is, okay? So I usually start with a straight leg raise, so I'm going to have you put both legs down and I'm just going to be feeling the pelvis. So go ahead, you're going to keep this right leg straight and go ahead and lift that right leg up for me. Good, and down. And then that left one. Any increased pain in the back with lifting either of your legs?
Not at that range of motion.
Okay. Do it again. Do the right one and down. And the left one. I didn't help you. And down. So you did have a little instability both sides when you lifted. When I give you external compression, the right one improved, the left one did not. So what we're going to do next is a little bit of a gapping, okay? So that'll tell me if you, so I know right here on the right side we need stability to improve what's going on the right side. The left side, that's not necessarily the case. So this is not the most comfortable thing in the world. And I actually almost always do it from the other side, so this feels really weird. Okay, try to lift your left one for me and down. Yeah, so this side needs mobility. So when I gapped you, gave you more movement, that side's stability or movement improved. So, yay, you're asymmetrical. All right.
Mom.
Yeah, right? Bend your knee for me. I'm gonna have you do now, this is a test for SI joint dysfunction, so where the spine meets the pelvis. Good, come back down onto me. Any pain with that?
No.
Okay. I'm gonna check the other side now. Here, we're gonna rotate away. Come down onto me. Nope, that's not what I want. That's what I want. You got long femurs. Try to relax for me. Any pain there?
No.
Go ahead and bend both your knees for me. Lift your bottom up. Oh, nope.
Oh.
Your
No,
butt.
just
Pick your
bottom.
butt up. Yep, and then butt down. And then legs straight out for me. Good. And then if you can, relax your head. I know you got your head on there.
Get the ball.
You relaxed? There you go. There you go. You look nice and level, so that's good. I'll check out your hip range of motion next, because a lot of times if people have back pain, the hips are an issue. Oh, that's nice. Okay. Not great, but not terrible. I've seen a lot worse. Any pain with that? Good. I mean, you're pretty symmetrical. All right, let's have you flip over onto your tummy now. Just feel this. Just gonna check some flexibility here. So you relax as best you can. There you are. So you got some tight muscles there. So what I'm looking for is his hip popping up, and on that side, I don't think it did. No, that side was okay. That side though, that left side, we've got some tightness. I'm just gonna do some gentle pressing, and I want you to tell me if there's any pain with it, okay?
Okay.
Any pain?
Nope.
Any pain?
Nope.
Any pain? Mobility-wise, this spine looks pretty good, okay? So I'm just gonna get into the meat of that tissue there. Try to relax as best you can while I stick my elbow in your butt cheek.
Your cheeks.
How's that feel?
Oh, lovely.
Yeah, you got yourself a real tight piriformis. Nicely done.
I've been told.
Woo! Yeah, and it's jumping. It wants to knock me off here. So this is like a diagnosis and treatment all in one. So we're just doing a little soft tissue release to that piriformis. If you could hear Thoema's labored breathing, you know it doesn't feel the greatest. Yeah, and it's jumping. Okay, let's hit that other side. See if anything's brewing there. Ooh, yeah, okay. Try to relax as best you can. This side actually feels a little more restricted. How is it pain-wise?
Minimal to nothing.
Yeah, okay. So it could just be some muscle guarding then, because not too many people enjoy having a person's elbow in their butt cheek. Yeah, there it goes. Ooh.
Yeah, I'm feeling it more now.
Yeah,
Not as painful as the left side though.
no. It is restricted though. Most of that glute tissue. Okay. So we went through the eval portion, which was long, I apologize, but that's really what it takes sometimes. So Thoema and I reviewed some other things off the camera, and so we do want to address some of his breathing. So with Thoema, we have a little bit of an asymmetrical rib cage. So we talked about and went through some belly breathing for him. So he would place one hand right on his belly button, one hand on his chest, and we're trying to get him to breathe through the belly. He had a lot of accessory or upper lung breathing going on, and we really want his diaphragm to be the mover for him. So that he did a really nice job switching from the upper apical chest breathing into the belly diaphragmatic breathing. So that was a great job. So the other thing we talked about were some restrictions that he has in his piriformis. He does have some tenderness along either IT band. So he's been doing some foam rolling, and obviously I just encouraged him to continue with that. We reviewed it. We're simpatico on how he was doing it. It was the left side. One of the stretches I often give my patients for the piriformis is a cross body stretch. So I think a lot of times we're very familiar with the figure 4 stretch, but that gets some different fiber orientations, and we're trying to get the restriction. So I would have you grab a hold of your knee, and you're going to pull it to the opposite shoulder, and you should feel it right through the glute.
Yep.
And I bet you do. Is that different than when you do like a figure 4 stretch? Does it feel any differently?
This one, yes.
Yeah. So there's reasons for that, but
Yeah.
essentially I would introduce this one too, because you're going to get a different fiber orientation of that muscle this way, okay? So with the stretching, I think it's best to hold for longer periods of time with a lower load. That's what the research shows is the best thing for tissue deformation or improving flexibility, okay? So the other thing that we discovered was that this right side, we had a little instability, motor impairment. So you're not unstable, the joints aren't unstable, you're not going to fall apart. Your muscles just aren't turning on real well to help protect you, okay? So have you bend both your knees? And this was like we did a few videos ago with Mike and the pelvic floor. So normally I start with like a pelvic tilt, and that's just to build awareness. But you already have awareness, so we don't need to start here. So what I would do then is a neutral spine. And like we talked about, I think a common misconception is a flat back is a neutral spine, and it's not. We want a gentle curve. So I would have you gently tilt, yep, hold that. And now reach, pick your butt up off the table. Good. And then what I'm gonna ask you to do, one hand on either side of your pelvis there. And I would like to see if you can do a march, but keep this pelvis level. So did you feel it drop? So that means you don't get to go that high. And back down. So you're wiggling all over the place, huh? Yeah. So what I would do then is have you go back to the table and you do a little bit of a tilt, engage there, and now try to march back down without that pelvis moving. So you're still dropping? Yep, you're still dropping. And that's okay. Sometimes it takes a few days and consistency to figure out what muscles you need to engage. So basically here up is going to hold you still. Here down will allow you to move. And once you have that mastered, then you move into bridged positions, seated positions, standing positions, and then that's how you can really progress that functional strength and stability of that lumbopelvic region.
Okay. And that's it, everyone. Thank you, Taryn, for helping me fix myself and giving me a kind of rundown diagnostic. And there you have it, guys. That's the gist of
what we
do.
Yep.
If you're experiencing pain, seek a professional. And then once we do the groundwork, the legwork, even the professionals need to go back to basics to fix their dysfunctions. And then once we master those basics, then you kind of see us and we'll take it from there. But baby steps.
Teamwork.
All right, guys. Thank you. Till next time.